going to do that. And then hopefully we can record some of the website training that we're going to dive into.
Perfect. You missed my part, so fantastic.
So before we dive into the website training, I do have a little mini poll for everyone to take, kind of asking some questions, asking a question about the website. So I'm going to go ahead and launch that now and then read it to you. The question is, are you using the consortium website to find information and forms? And it's an easy yes or no. So I'll give you a minute or two to fill that out, and then I'll let you know what our results look like. All right, we're right around 76%, which is about equal to the amount of benefits clerks that we have. I know we have quite a few presenters who don't need to take this poll. So the results are 64% say yes and 36% say no. So that's why we're having the website training, to go over where you can find stuff on our website, how you can use it as a useful tool to print off updated forms, and to finally review that darn portal that I get emails about being like, this password does not work. So let's go over that together. So let me bring that up here real quick. Let's try to make this a tad bit bigger. Can everybody see that okay? Is that big enough? Okay, I'm getting head nods. I'm going with it. All right. So with our website, we have a variety of tools on our website that you can use. As you can see here, this is our website location. It's healthconsortium.net. I would recommend typing that in and saving that to your favorites, just so you have easy access to it. So today we're kind of going to go over the whole website, where to find things, how to look up things, and all those different topics. So we'll go over the website homepage, how to access agendas and minutes from committee meetings, because I know we don't always make it to the meetings, but we want to stay informed and know what's going on with inside the consortium. We're going to review where to find your benefit summaries, which I know we're headed into open enrollment right now, and you're probably being asked questions about benefits. This would be a great way to look up that information and print it off and hand it to an employee. We're going to go over where to find enrollment forms and plan change forms, how to submit plan changes to the consortium. So we'll talk about how to use the portal that we have on our website, how to access other municipality website tools, and also where to find information about our wellness program as well as our newsletter. So this is the homepage for our website. The images in the background kind of is like a slideshow, but the menu up at the top that you see, governance and things, is where you're going to find a majority of the tools that you'll be using. We tried to set up our website so it not only works for municipalities, but can also work for employees, retirees, as well as potential members that we don't have yet. So people, other municipalities that may be interested in joining us and want to see what our plans are, see what our premium rates are. All that information can be found on our website. So the first area of the website is over on the left-hand side on the main homepage. It's under governance. So you would just hover over governance and it would be a drop-down menu. And you can select if you want to go look at committees' agendas, if you want to go look at minutes. We even post recordings of all of our committee meetings. So if you wanted to go watch the recordings, you could do so as well. This is a great opportunity to stay informed with decisions or questions that are upcoming to the consortium, or even, like Rob just mentioned, government mandates that are coming down the way that we have to update benefits to meet those mandates. This is all information that you can find here. Now, I know we send out a lot of emails in reminding you to come to committee meetings. If perchance you lose an email and you need a copy of the agenda, this is where you can find it. The Zoom links for the meetings is no longer posted on our website. So if you need the Zoom link again, you would have to email Michelle. And that email is given here at the consortium at Tompkins. www.cobra.co.org. She's our main contact person for meetings and attendance and different aspects like that, as well as our lovely lady who does all of our minutes and agendas for us. So the next tab over is employee, retiree, and wellness information. So you would hover over it to get this drop-down menu. Now this is the area, we'll talk about appeals a little bit later on with Excelis and ProAct. So I'm not going to dive into that, but we will talk about the plan information by municipality. This is where you're going to find your benefit summaries that you may have employees that either want to go look it up themselves or may want you to print it out and give it to them. So you're going to want to know where this tab is. Right now, we don't have the 2022 benefit summaries up, but there is no change in benefits from 2021 to 2022. So what's there is still current, but we will be posting those as soon as we get them from Excelis. So once you click into the plan information by municipality and you scroll down, it'll be a list of all of our members. And so it'll be hyperlinked. So you're going to click into your municipality, and then this is what will come up. And what this is it's a benefit summary and also a summary of benefits, which I know sounds like it should be the same thing, but they're different. And we'll go over that in a minute. But you'll see the list of plans that you have available in your municipality. You'll also hopefully see the prescription copay rates as well here. And if you click on the prescription plan up at the top, it's blue. That's actually hyperlinked to the ProAct drug formulary. If you had a member who was searching for a certain medication, you could direct them to use our website to go look it up. You could assist them with looking it up. I've also had plenty of you that have emailed me and said, look, they want answers on all of these meds. Feel free to use me as a resource and send me those emails. If you want me to follow up directly with employees, I can call them, I can email them, I can do whatever you feel is helpful to you. So don't hesitate to reach out to me. Or if you forget where to find it, feel free to let me know and I can just go over it with you. So what's the difference between a benefit summary and a summary of benefits? So a benefit summary is a very brief overview of the benefits to the plan. So it will review, is there a deductible? Is there a co-insurance? What's the maximum out of pocket for in and out of network? That's information that you can pull from a benefit summary, whereas a summary of benefits actually goes over more detail. It's a little bit heavy on the text, but it goes over questions that you may be asked, like what's included in my out-of-pocket limit? Different questions like that. So these are longer forms, but they kind of dive in deeper where you may be being asked questions. So one of the things that all of you have to do is submit enrollment forms from time to time. So when you have employees who are new hires, when you have employees who are leaving their status with you of employment, you would have to submit an updated enrollment form to the consortium through our website portal. And the reason why I'm emphasizing through the portal is because it's a way to protect your municipality from any HIPAA violations. If you directly email it to me, it's not encrypted. It includes information like date of birth and social security numbers. We really want to make sure that those forms are being submitted through our portal, which is then protected and encrypted, and we don't have to worry about that information being more public than it needs to be. So in the next few slides, I will go over how to fill out an enrollment form, and then we will go over how to submit that through the portal. But first, where do I find the enrollment forms, right? So you would go under Municipal Resources, which is the center drop-down menu. You would hover over top, click into portal number 1. Now, when you first bring up that screen, it won't show this listing. You need to scroll down a little bit and you will start seeing the listing of all of the municipalities that are covered under the consortium. And then you will click on your municipality and it will directly link over to your enrollment form. Now, these are new enrollment forms. They were just uploaded to the website yesterday and then again last week. So yesterday we got a lot of feedback on these forms, great feedback, updates that would make it easy and simpler to understand. For example, over here it does say that there's self-only, self and children. Well, in the consortium, we only have individual plans or family plans. So we've eliminated these sections. So those options aren't there where they may confuse your employees when they're filling out the enrollment form. In addition, the consortium does not offer dental coverage. So we've eliminated this section on the enrollment form as well. Those updates have already been uploaded to our website. We do have 12 municipalities that offer dental insurance through Excelis, and we're still working with Excelis to have those hopefully added to the enrollment form so it can be one complete Excelis enrollment form to make it more streamlined, but we're still working on that edit. So this is the overall enrollment form. It will show your municipality and your group number, and then any of your available plans for enrollment will be listed under medical plan selection. It's important to complete as much of the form as you can. And what I mean by that is if you checking a box to make sure that you're picking a plan for them, making sure you're telling us what date do you want the insurance to start. Some municipalities start the date of hire. Some municipalities start the first of the following month, and some even have a probationary period where it starts 2 months after. So it's important to make sure that that date aligns with when you want the plan to start. If you start an employee, let's say an employee starts for you today, October 19th, and you want the insurance to start October 19th, that's perfectly fine, but you will be billed for the full month of October. The same goes with ending insurance coverage. So if you end insurance coverage and let's say today was their last day at work, and you send this form in and say end coverage November 1st, that means you will be billed for all of November. But if you put October 31st, then the coverage for that employee will end the end of October and you will only be billed for October. So something important to keep in mind when you're filling out these forms. So we're going to briefly review how to fill out this form for a new hire. So you would want to check all the areas that are circled in red. You would want to make sure that they're fully filled out. The one in blue is only if you know the subgroup numbers. It's okay if you don't, because a lot of you only have 1 or 2 plans. Our larger groups that have, 7 to 10 plans, the subgroups become more important because that's how they assign it to their union contracts. But this mainly does not pertain to our smaller municipalities that I work directly with. So then in section 2, you're going to want to make sure to fill out all the information about the new employee, who is also going to be called the subscriber. Of course, if they have dependents or spouses that need coverage or domestic partners that need coverage, you would fill out those additional sections as well. And you just want to make sure that you're marking that it's a new hire, and you want to make sure that you're including the date of birth and the social security number. As you can see, there's been some additions to the form to make sure that it meets certain government standards. So gender identity has been added here, as well as gender assigned at birth. Some different wording has changed here. These are the new applications from Excelis that have been approved by Department of Finance. So things have shifted a little bit on where you're going to find the location of things. For example, on the old forms, you had the date of hire and the start date for the medical plan, one right after the other. And it took me a minute looking at this form. I thought they left out a section. So as you can see, section 2 contains date of hire, but section 1 here contains when you would start the medical plan. So when you have a moment to go in and take a look at the new forms, if you have feedback on them, I'd love to hear it, to make sure that we have a tool that's useful for everyone. And of course, if you have any questions, don't don't hesitate to reach out to me and we can go over it together. And then section 5 is where you would enter the spouse, domestic partner, dependent child. A very brief review, dependents must be under the age of 26, and direct children, stepchildren, adopted children, or domestic partner dependents of the subscriber in order to qualify for coverage. It's been recently asked by a few municipalities if grandchildren would be covered if they were the child of a covered dependent. So as in they're covering their child and their child had a child. And grandchildren are not covered as dependents unless they're being adopted by the grandparent who is the subscriber. So just some tidbit to keep in mind. And then section 6 would only need to be completed if there was additional coverage. So we've seen this case where perhaps a married couple, they cover each other on insurance. Well, that matters to us to make sure that the coordination of benefits is set up properly of what insurance is primary and what insurance would be secondary. And then of course, at the end, please make sure that the subscriber signs the form and dates it. It kind of makes it official that they're agreeing to join the insurance. So we do need those signatures on there. Okay, we're going to go over how to use the portal. Now that you've filled out an enrollment form, you're going to scan it and save it as a PDF file, because then you're going to upload that when you use our portal. So then the next step would be to log in the portal, which we'll go over where to find it and how to do that. Complete the form that comes up once you're logged in, upload the enrollment form, and then hit submit. That's sent directly to me once it's scanned and all of those lovely things. And then we reply back to you within 3 business days to let you know it's been processed, or if we have any questions about the enrollment form. Okay, so where to find the portal? You would still go under municipal resources. You would still click on portal 1, but instead of scrolling all the way down to your municipality to find the enrollment form, it's actually up towards the top under web portal, and it's hyperlinked. And I have a list here of all the municipalities that use the consortium portal, which is quite a few. But I do know too that you don't necessarily have a lot of employee turnover or changes, so you may not be using it on a regular basis. That's why after today, I will be sending out this presentation so you can have it at your desk as a reference when you need to use the portal 6 months from now and not have to remember this training detail for detail. So once you click on the web portal, a screen will come up that'll ask you what municipality you are. Are you a city, town, or village? Because we do have the town and village of Dryden. We do have cases like that where we need to designate exactly which one you're using. And then the password. So I did not create this password, I swear. But everyone has had difficulty with this password. So I thought I would make it big and bold and easy. I myself have struggled with this password. Michelle had to walk me through it numerous times until we figured out this first symbol here that could be a 1, it could be an L or an I, is actually a capital I, and then 2 numbers, a letter, a number, a letter. So it's right here for you. You can copy this. I can also email it to you, and you can cut and paste it every time you need it, whatever works for you. Everyone has the same password. We don't have different passwords per municipality. Everyone uses the same password to get into the portal. Once you type in the password, this will be your next screen. We do ask that you fill this out. That way I know who to email back to let you know that the enrollment's been completed or the termination's been completed. This tells me who I should be in touch with to give you updates on processing the form you submitted. Now, when we get down here, we did add a couple questions. Have you signed the enrollment form and included an effective date? We've been struggling to make sure that the subscriber signs, but also that the municipality representative signs the form. And then to make sure that you're telling us when you want the insurance to start, which is an important part. The other aspect is, have you completed a member verification form and filed it with your employee records? Now, the member verification form was emailed out with the agenda. It has been updated to be a little bit more user friendly. But what that is making sure that on your end, you're getting proof of date of birth. You're getting a copy of the Social Security card. You're making sure they are who they say they are. You're making sure that they've documented, maybe it's filling out the domestic partner affidavit, that you have those documents in your records. We do not need them at the consortium, but you need them on your end in part of the HR record for the employee. So these are just kind of double checking to make sure that you got those aspects taken care of before submitting to enroll the employee into our coverage. So once this is all filled out, you click and you upload the enrollment form, you click submit, and it comes our way. Now, this is a very brief overview of some other tools that are on the website that you may want to take advantage of. This is under municipal resources. You can find where you can look up your own premium rates by the municipality. Perhaps you may have forgotten what the rate is. You can go in here and check. This also includes the Excelis Administrator's Guide that talks about the Excelis website, but it also talks about who qualifies for coverage, who doesn't, different aspects like that. You can look up benefit plans and optional programs. So this is where you can find information on the CSEA dental program. You can find information on Canna RX, which is a prescription discount program that we, the consortium, are enrolled in, and then offer it to all of our members. A way to save on medication costs. And then down here, the dependent certification. This is where you can find duplicate copies of the member eligibility verification form, because you really should be filling that out for every employee. So you would need multiple copies over the course of time. So you can find all of that here. So, I mean, it doesn't hurt to kind of cruise around our website and check out where things are and get comfortable with where you can find them. Or you can be like me, who just bookmarks a whole bunch of different pages and then can easily go find it under my bookmarks. We also, and I know you've been receiving the emails, we also do a wellness program. All the emails that are sent out, we also put information on our website if you ever wanted to link employees back to our website. We try to promote our winners of our well-being challenge, of our wellness challenges. We did an Eat Fresh challenge in August as well. So if we have photos or information about them, we try to praise them and promote being healthy and being active. And so information can be found here under employee, retiree, and wellness information. There's a wellness tab. Click into it, it provides you information. This is where you could recently find flu clinic registration links. This is where you can now go to register for our upcoming challenge starting November 1st, the Maintain Don't Gain challenge. So all good things can be found there. We do email out a hyperlink to our newsletter, but if you ever wanted to go back and read old newsletters, or perhaps you can't find that email we sent, our website always has all of our newsletters posted. The most current one is up at the top of the list, but you can find this on our homepage at the far right. You can click right here to find our newsletter and information. We try to include topics that have been concerning for people. Recently, we talked about the COVID booster shots in our newsletter. We also take that opportunity to introduce new staff. I know my picture made the front page this time, and different topics like that. So it's a short newsletter, but it's definitely full of great information. So thank you for sitting through all of that information. And are there any questions for me on the website or this part of the presentations you're going to hear today? Okay, I'm not hearing or seeing any. So I'm going to hand it over to Kelly to jump into our Excelis updates and some quick review.
Thanks, Kylie. Good morning, everybody. As Elin and Kylie said, I'm Kelly Lasher, and I'm the Regional Sales Manager over at Excelis for all of our strategic accounts. And I have the great pleasure to be your interim account manager managing the consortium along with Elin and Kylie. So today I'm just going to go through a few updates, and I'm going to have my friend Jason share his screen for me. We're tag teaming today. Slideshow. There you go. Perfect. Thank you, Jason. So if you can just skip to the next slide. I'm just going to talk about a couple things as Rob teed up this morning in his very banter way about some COVID stuff happening and ID cards. And then Jason's going to walk through some online support tools for your members to take advantage of. So a couple of things in the COVID space just to be aware of. The non-COVID telehealth visits are now subject to cost share in network and deductible and co-insurance out of network. So for any virtual type visits being done via telehealth, whether that's through an individual's primary care physician through a virtual space or through the MD Live network that Jason will touch on later, for anything non-COVID telehealth, so anything outside of COVID, will take your applicable cost share for the plan the member is enrolled in, both on the in-network and on-a-network basis. However, through still the public emergency, all COVID visits are still covered in full. So there's no member cost share for anything with a COVID diagnosis. So that's going into the physician's office visit, urgent care, ER, any services related to the COVID-19. Any questions on that? So just want to talk a little bit about testing, because obviously that has been coming up very recently with all the COVID cases spiking throughout the communities. Our testing policy remains the same and is consistent with our medical policy along with the CDC guidance. And that all testing is included at no cost for medical necessity testing. That's for your diagnostic and viral testing, any antibody testing, but it does need to be medical appropriate and have a COVID-19 diagnosis. It also has to be done by an attending provider and performed in a lab that is participating and certified. Testing will not be covered for things like pandemic control, reopening of businesses or schools, or any testing on asymptomatic individuals just to assess whether their health status, or anything required by employers or schools to get testing. That is not covered under the health plan. There are on our website, the COVID-19 microsite, there is information on the New York State Department of Health, all the clinics that are available in the community that offer free testing for situations such as that. However, under the health plan, those will not be a covered benefit. Any questions on testing? Oh, you guys are a quiet group this morning. You better go grab another cup of coffee. So the other piece on COVID is relative to vaccine coverage. Because of the public health state of emergency, all vaccine coverage is at no cost. So there's no member cost share to receive the vaccine. All the COVID-19 vaccines are approved. They're safe and effective. So the Pfizer, the Moderna, and the Johnson & Johnson, as well as the additional third shot and booster shots, are all available at no cost to your members. A prescription is not required for the COVID-19 vaccine, so members can just go and receive the vaccine where available. As I did mention, they're on our website, the COVID-19 microsite. If you haven't taken advantage of that or your members haven't, please go out there. There's all the up-to-date information on COVID-19 and what's happening in the community, as well as anything related to the benefits covered under the plan and vaccination status. So before I flip to ID cards, does anyone have any further questions relative to COVID-19 and benefits? Okay, so as Rob had stated earlier at the top of the hour, there has been some changes relative to the Department of Financial Services, as well as federal mandates that affect the ID cards that members will be receiving on 1/1/2022. So I just wanted to take a few moments to go through what those changes are and what the cards will look like moving forward. So moving forward, ID cards, currently only your subscribers are receiving a set of ID cards, and if they have dependents under the plan, they're ordering additional ID cards for them. Moving forward, all your subscribers will continue to receive your 2 sets of cards, but any dependent enrolled on their plan will also receive an identification card with their name on it in their own envelope. So if there are newborns under the plan, that newborn will receive their card in their own envelope addressed to them separately to that mailing address. Also keep in mind that all of our member ID cards can be accessed via the mobile app, which Jason will talk about in a little bit. So I think all of you know what our ID cards look like. They're like this big, and there's a lot more information that needs to be placed on it. So if you didn't think there was enough information on there, there's more coming. Some new things that are going to be added to the ID card are the plan information, urgent care copays. New this year, your ProAct information will be included on the ID card. So the ProAct logo, the ProAct website, the ProAct customer service number will all be on the one ID card. So members will only need to access one ID card moving forward when they're seeing any of their physicians, hospitals, or pharmacies. Deductible and out-of-pocket max, both in and out of network, will now be additionally added on the card. And then language on the back of the card stating that they are, that your plan is self-funded. So the next slide shows just what the ID card will look like. This is not specific to the Greater Tompkins Consortium, but just gives you an idea of all of the things that will now be on the ID card. There will be that little box in the lower left-hand corner is a QR code that can be scanned with your cell phone, and all your benefits will pop up. So that is a new feature moving forward. The ProAct information where it says RX, the ProAct logo will be listed there. So you'll see that on the ID card. Where the RX formulary is, the ProAct website information will be listed on there. And on the back of the card where all of our customer service numbers are, the ProAct number will be on there as well. The card on the right is the dependent card. All of the information on there is the same as the subscriber card. However, the dependent name is now listed in the upper right-hand corner. So those cards are planned to be mailed prior to the 1/1 effective date, and they will go to all members that are all active members that are enrolled in the consortium. Does anyone have any questions about ID cards? Okay, I'm going to flip it over to Jason to talk about some online tools and resources that are available to your members to take advantage of moving forward.
Great, thank you, Kelly. Kylie, just to check in, do you have something at this point for a poll?
I don't, just when we
Okay.
get to the wellness programs.
Okay, Good. I just wanted to check. Thank you. And sorry for my happy clicking. I have a happy click finger this morning. So I hope everyone is doing well. As Kelly alluded to, I wanted to provide you with, I guess, really some key resources, tools that members have at their fingertips. And in this case, as Kelly mentioned, our website login and our mobile app, and really being able to help that member self-service and find answers online to the questions that you see here, plus a lot more when it comes to having a website login and mobile app with Excellus Blue Cross. So I met my deductible is the first question, right? You're able to check that and understand where your money is being spent. As Kelly mentioned as well, do I need a member card? And how can I get one? You can do that right through the website and mobile app. Why was my claim denied? So you can check the status of any claim that is pending, or maybe it's been completed or verified. You can find that answer as well once you log in. What are my benefits, right? So you can check and see what coverage you have under your plan, depending on what municipality you might be. But that having that right at your fingertips is something that we want members to do. Is the service that you're looking to have, is that covered? Is it covered for you? Is it a covered benefit? So if you're wondering, you can find that answer right online. Is the provider that you're looking to go to, are they in network? Maybe you're out of state, maybe you had to go to the hospital. You can check and find whether or not that provider is in network. You'll see the cost estimator as well. There is a function on our website and mobile app that you can actually check to see what you're going to spend. What is that going to cost you now and then when everything is completed with that type of procedure? So I like to really equate that to a financial well-being piece, right? So you're able to see where your money is going. You're able to see how much it's going to cost you, your family, and any subscriber, if you're the main subscriber, what a procedure might cost. So again, kind of relating it back to well-being, financial well-being, physical, and you'll see some pieces on mental health as well as we go through the rest of these slides. And then finally, that physical aspect, that physical well-being. Do I have a discount for a gym membership? You can find that right there and right then and there. So I did make another plug. So hopefully you have seen this already within Kelly's slides, but our microsite for COVID-19, great resources exist there. So your dashboard, once you have registered and begin to log in with Excellus Blue Cross Blue Shield, whether it's on your desktop, your tablet, or your smartphone, hopefully some of you do have the Excellus app on your phone. It is the same username, same password for both. The dashboard does look like that. It is the main screen, so you'll see if you are the main subscriber, your name. You can click on paperless settings, view statements. It'll show the plan name if it's a metal level plan. In this case, we're showing, this is just an example, bronze standard family plan. Your subscriber ID, which does include that 3-letter prefix, and you'll need that, and it is required in some of the other tools that we have coming up. It'll list all the plan members, so the subscriber, your dependents, if you have them. I have 2 kids, they're listed on mine. I'm not actually the subscriber on my Excellus plan, but my wife is. So you can see all that stuff up front. It's right there in your face, and you can access that. You can also use the Pay Your Bill Now, which is online pay tool that's available to all Excellus members. Again, if you're looking for a member card, I know there's changes coming in the new year. This is where you would begin searching and asking for a new one. If you do have your mobile app, you can pull it right up on your phone. The financial piece, if you look to the right where it tracks, and this example does show where you are within network, what your family deductible is, your remaining deductible at the bottom there. So it gives you a nice graphic of where you are currently. And in this case, the person has, or this family deductible is $2,500 max, and they have currently spent $975 toward that. Family out of pocket as well. This case, it's a $4,000 max, and you can see, so this will track, based on claims, based on visits to any provider or medical facility. There is an out-of-network.
And Jason, I just did want to mention here, because I did misspeak yesterday, for those subscribers that are enrolled in the med level plans, this dashboard will be inclusive of your medical and prescription drug spend, total spend. So the PROACT numbers are accumulating into this feed. So if you're on the gold, silver, platinum, bronze plans, this dashboard will be reflective both of medical and drug.
Great, thank you, Kelly.
So Kylie, if you could just make note of that for the group yesterday, that would be helpful.
Sure.
Thank you.
Great. And then again, just the side there, it does list of what you can access on your dashboard and what you can view. So I did cover those. Just a highlight on the next page. So tying right into our mobile app, again, username, password is the same for both. So if you haven't downloaded the Excelis mobile app, I strongly suggest that you do to have that with you on the go at all times. Again, convenient access to view and order your member ID cards. You can pull it right up on your smartphone, show it to your provider, track that spending and deductibles where you are. Again, checking coverage and benefits. I like to really highlight the Find a Doctor tool. So maybe you are in need of finding a primary care provider or some provider in your local community. Our search function will allow you to do that. It's a critical step to all healthcare to have a primary care physician. So this feature will allow you and your family to do such. You can also select the Go Paperless feature if that's something that you want to do and receive everything via email or electronically rather than being sent home. Again, you can also view and filter your claims through the mobile app. As I mentioned earlier, the estimation of medical costs. So there is, like I said, the cost calculator that will help you budget, plan, financially for medical expenses for you, yourself, your dependents, and whoever, is there, what you're looking at to do for a healthcare visit that might be coming up. Again, estimating out-of-pocket costs, based on your year-to-date spending and deductible. You can research estimated medical costs across more than 1,600 treatment categories and over 400 plus procedures. So again, a very great tool, I think, in the financial aspect that we all should be considering. Listing of providers, right? So here you have a way to filter results by what the cost might be for a specialty or a specialist, treatments that you're looking into, where those locations are, so you can filter all of those things to help you better pinpoint a provider or a specialist. Access treatment timelines. So again, understanding, if you have an upcoming procedure, to understand what your timeline, how you can help navigate through those procedures, what early evaluations, follow-ups, recovery time, and then as well as a breakdown of costs throughout that entire treatment. Telemedicine, I will highlight here. This is another resource. So alongside Excelis, our mobile app, we strongly encourage members of the consortium to also have MD Live registered, or maybe you haven't registered, but there's great opportunity for you to access their providers. When you should not use telemedicine. I guess if your doctor is there, you're currently speaking with them, but if he or she is not available, telemedicine is a great benefit. It is a part of the Excelis network. It is considered a network. There's basically two buckets. So any visit through MD Live for non-emergency medical telemedicine, you can see the listing of certain conditions or common conditions that can be treated via telemedicine with MD Live are listed there. So, rather than going to the ER or maybe going to an urgent care, you could, have a telemedicine visit with MD Live for cold and flu, rather than the potential of getting even more sick there, or maybe time is of the essence. Your family member, maybe some of you have tried MD Live. If not, I strongly suggest that you register for it. I will highlight for behavioral health, and you'll see in some of the coming slides when it comes to well-being and mental health. You also have access to MD Live's providers for behavioral health conditions listed there. So addictions, anxiety, stress, depression, eating disorders, they are all there. What's a little bit different with the behavioral health piece of MD Live is that, we want you to, if you choose to see a provider, continue that relationship, develop a relationship, whether it's family counseling or seeing a psychiatrist. You can do that. And you do have to make an appointment for a behavioral health visit, whereas the non-emergency medical or acute type of visit, you can select any available provider at that moment. Again, what is the cost for a telemedicine visit? Once you have registered, and I'll note that when you are registering for MD Live, you do need your Excelis subscriber ID, including that 3-letter prefix. There's a couple different ways that you can register via online, downloading the MD Live app, as well as a couple of others. But at this point, the cost will appear after selecting a specific provider. So whether you're choosing a non-emergency medical telemedicine visit for your, let's say, your dependent, you would see upfront what that copay, if at all, would be for you for your plan. Again, based upon what you have with Excelis is what you will pay. Any questions on telemedicine? Very good. I'll turn it over to Kylie. I think you've got a poll.
I do. This is the test to make sure everyone's still awake. No, I'm kidding. So the poll is very simple. It's just about the wellness programs provided by Excelis and how familiar you are with them. So I'm just going to launch it. Question reads, are you familiar with the following Excelis wellness programs? Check all that you know. Blue 365, WellFrame, and Blue for You. I'll give you a couple minutes to have everyone enter in their answers. Okay, right around 60% have replied. So let's see here. So for Blue 365, we're at 58%. WellFrame, 16% of our benefits clerks know about it. And for Blue for You, we're at 47% are aware of the program. So I'm going to hand it back over to Jason to kind of talk about those programs as an overview.
Great. Thank you, Kylie. And thank you everyone for taking that poll. It really does help us as we work with Elin and Kylie to provide programming. And I think the resources that Excelis has to offer really do touch upon the various well-being elements, right? So it is financial, it's the physical as well as emotional, and there are others, but those are really the top 3 that we focus on. And I do like to share, oops, I'm sorry, my clicky fingers, bear with me. So the what you're seeing here is 2021, our wellness industry trends. It's no surprise at the top, more employers are investing in mental health, stress management, as well as resilience, mindfulness, and meditation. And then the 4th one up top there is telemedicine or telehealth. So again, more companies are putting resources, they're trying to provide programming, tools for their employees, as we have seen a dramatic shift in what our workforce, whether you're in government or whether you're in a health system, are really trying to provide assistance in that space. It is also in comparison to employers not spending as much when it comes to having on-site health fairs, right? We've been virtual, or our face-to-face has been limited. Maybe your break rooms were fully stocked previously. Maybe you do offer biometric screenings. In this case, Greater Tompkins has offered it over the past couple of years and will continue to do so. However, some employer groups are not putting their resource behind that biometric screening. As far as on-site fitness classes, that is something as well. A lot of it has gone virtual. So I like to show the trends of what we are seeing, with the groups that I partner with, and you'll see some of the upcoming pieces that I think, Greater Tompkins is really starting to focus on is stress management, is mental health, having a more strategic look at where members can be helped. So when it comes to Excelis, as far as your health plan, right, we want every Excelis member to be, have some sort of self-serving way to access the resources that we have. We try to make it simple for that member of what they can find, what's available to them. And this graphic really does depict that. So you have that Excelis member in the middle, and each one of those spokes shows that member what they have access to when they have a health plan with Excelis. In this case, the web or mobile app, like we touched on, understanding your benefits, specifically with care management and WellFrame, as you'll see. And really, there's three big pieces that we'll be rolling out in as far as Excelis's resources in the rest of this year and going into next year is the WellFrame app, MD Live, and Excelis mobile app. So those three things are going to be critical pieces that we want every member to access. With WellFrame, you have the capability to help. Maybe let's say you have a chronic condition, you're dealing with diabetes. You can connect with our care management team, which is a provider at the Excelis level that can help that member, with their treatment, understand their disease management, and the like. So you'll see more of that to come as we roll out parts of well-being for the consortium the rest of this year and into next year. Like we talked about the medical costs, you can estimate them there. We have mentioned the member ID card. It's good to see that we have the ProAct information now on the member card, but if information is there, we because your pharmacy benefits manager is through ProAct, they have some great resources as well. So tying into that pharmacy piece of things. For health and wellness, right, you have the capability to find your gym discounts, find information on being physically fit or active, or maybe you have high cholesterol. How can you help manage that? So there's a lot of different pieces that are there for that member to find, and we can help them do that. Find a doctor. Again, going to your doctor is a critical step to healthcare. And having that at your fingertips is something that, we want that member to continue and know where to search for a provider. We did talk about telemedicine, but you also have access to our 24/7 nurse call line, which you can see there. So again, all these pieces wrapped around that person that has Excelis. We want to make it easy for them. We want to show them how to find these resources. I did talk about WellFrame specifically to it. It is another app that we want members to start using. I know we have not done a lot of campaigning, but that is something that's likely to change in the coming months. Help educate members on how WellFrame can be a useful tool for them, whether they are wanting to engage in any of the self-guided pieces that you see there on the left. So behavioral health, right? So we saw that in the trends. We want members to help manage their anxiety, and they can do that through the WellFrame app and in conjunction with our care management team. If it's depression, right, how can you help manage that type of condition, as well as the others that are listed there, and plus more. Maybe it's an expectant mother. We have a maternal health program that can help that member through all stages to delivery, right? So if they are expecting, there is a program and a way to work with our care management team and a registered nurse for that program. You'll see the others that exist here. And really these are some of the top pieces that we see in prevalent condition-wise within the consortium and within many of the groups that we work with. I will highlight quickly the diabetes piece. So if you have members that maybe are in trying to prevent diabetes or have pre-diabetes, there is programming that can help that member, stave off any onset of late stage diabetes for that person. Wellness and prevention, there is different tracks that a member can engage in when it comes to weight loss, physical activity. There is a tobacco cessation program that exists as well, and helping that person, right? So if they have, maybe they have forgotten or have chosen not to go to the doctor for, specific preventative screenings, the gaps in care feature can help that member set reminders, have them know when their upcoming visits are. There's medication reminders that exist there as well, understanding those medications that you might be on. So again, a great app, a great way to help any member in anywhere along the line of healthcare spectrum, understanding the disease that they might have. As Kylie had mentioned in the polling, Blue 365 is a free resource for any Excelis member. There's all sorts of discounts and deals that change, weekly. Actually just got one yesterday with the latest deal, but they provide ways to find discounts, provide you with various things. Maybe it's on apparel and activewear, or maybe it might be, fitness activity pieces. If you see the one right up there, not all of us, but some of us do have our wearable device. You can find or get discounts. In this case, this is just an example of Fitbit of being one of those wearable devices. So if you're into tracking your physical activity, you can do that. There's various pieces on hearing and hearing aid discounts that you can access. So lots of great resources for you that can help you in the physical sense, the mental health sense, and much more. Again, saving you money. We want you to see what you can find. This is a great resource. You do have to register for Blue 365. You'll get your weekly deals, like I said. Fitness Your Way does exist. It is brought to you by Tivity Health and does offer a passport where you can find discounts at over 10,000 plus facilities nationwide. As we will highlight the closing of 2021, we did offer a biometric screening for the consortium, 2 different programs, although in conjunction and partnership with IH21. So we did have the incentive program that was offered and providing on-site biometric screening, but it also did and offered the capability to test it alone or see if your doctor, if you had a visit with him, where you could provide that to enter into the Blue for You screening. We're really trying to build this program in 2022, make it a little bit easier for members to sign up for a biometric screening. So looking at some of the conditions and risk factors in previous screenings, we look at high blood pressure. That was one piece that came up, as well as hypertension. Stress and anxiety was in some of the lifestyle questionnaires. So hopefully you are familiar, hopefully you have heard of the Blue for You screenings. But in 2022, we certainly are going to want to improve the program and make it more readily available. And hopefully this is kind of your gateway to do such. Kylie or Elin, did you have anything you wanted to add for Blue for You?
The Blue for You is only available to the meta level plans. Is that correct?
That is correct.
Okay, just wanted to throw that out there too.
And one of the things with Blue for You, some of our outlying smaller municipalities have not participated because it hasn't been conveniently located. So that's one of the things we're talking about with Excelis is how can we make this program more accessible to all our members? So we'll continue those conversations. But do want to encourage people as they're thinking about wellness programs, or if you're thinking about wellness programs or incentive programs, Tompkins County has an outcome-based program, which they use this for. City of Ithaca is going to kind of mirror their program. And this is a resource we get through Excelis, so your employees can know their numbers. And Seneca County uses information differently, but this is a good springboard for encouraging employees to know their numbers and the value of knowing your numbers and identifying problems early. So Joint Committee will continue to talk about Blue for You. We offer it in the early spring and or late winter. And I think all the resources, we saw that the percentages of everybody not knowing about all of these resources and the value of them that comes by having Excelis as our TPA are very valuable to us. And we're trying to make sure all of you have access to that as well. So thanks, Jason.
Yep, thank you, Kylie. Thank you, Elin. And I am finished with my piece. I'll turn it back over to Kelly.
I'm gonna hop in here.
Okay, yeah.
Yeah.
Jason, you can stop sharing.
So we're gonna go to the next agenda item, which is talking about the Consortium Wellness Program. So first of all, I have another poll for you. This just kind of gives us an idea of how well we're doing, how well the information is being shared with the wellness emails we're sending out. So the question reads, how many of you read and share with your staff the monthly wellness emails? And you have multiple options to choose from, but you can only choose one. So yes, I share every month. Kind of, I share them, but I don't read them myself. Kind of, I read them, but I don't share them with staff. No, I don't read nor share them with staff. And this just kind of gives us an idea of how well the information is getting out there to your employees as well as you yourself. So I'll just give you a minute to put in your answers. Okay, so we're holding steady right around 78% participate in the poll, which sounds about right. So 54% said yes, they share every month. 23% said kind of, I share them, but I don't read them myself. 15% said kind of, I read them, but I don't share them with staff. And 8% said, no, I don't read them, nor do I share them. So that just kind of gives us an idea of how well the information is getting out there. So right now, I develop the monthly wellness emails. This month is October Breast Cancer Awareness Month. We're promoting to wear pink this coming Friday at your workplace as a way to promote awareness about breast cancer awareness and going to get your screenings done and everything like that. So something to keep in mind. And then we have an upcoming challenge that was very popular last year, our Maintain Don't Gain challenge, which will run from November 1st till the beginning of January 2022. It's not a weight loss program. It is just healthy tips to get us through the holidays. The registration opened October 15th and it'll be open till November 5th if you're interested. What it entails is you register. I email you once a week with healthy tips on eating, on exercise, on meditation and mental health. You can read them. They'll come with some links if you want to further dive into that information. It'll be there. What we do with the emails, one is we're trying not to send out multiple monthly emails. We try to just send them out once in hopes that you would share them with your staff to promote being healthy and the wellness program that we are offering. We try to come up with fun challenges where employees can earn prizes, gift certificates, different things like that, in an effort to motivate to keep moving or to eat healthy or to take time to meditate or all of those things that encompass being healthy. So with that being said, we are aware that our benefit clerks do not just answer our emails. You are doing 100 different things and you are very busy. So I'd like to throw this idea out that if you have an employee at your workplace that would be interested in being a wellness champion, They could be the ones that are sent the emails. They could be the ones that are in charge of emailing it out to all the staff, printing the flyers and posting them on your bulletin board, or even coming up with mini challenges with inside your municipality, such as counting steps for a month or different things like that. I could work directly with them, and it would be a way to take one less email and all of those things that come with it off of your plate. So if you know of anyone in your municipality that might be interested in helping promote wellness in your workplace, I'd be more than willing to talk to them about what we do and how they could help us promote those programs and information. As well as, we know that it's difficult to always be in touch with employees. We know we're working, you have staff that are out on the highway who are plowing snow or who are rebuilding roads, and they are not in your office to talk to, and they may not check their email every day. So we are also looking to set up a Facebook account moving forward where we could help promote some of those wellness activities and be in direct contact with our subscribers, rather than you having to always promote all the information through you. So that is coming. We have taken that and discussed it with the joint committee, and we will be moving forward on that shortly. When that information comes out, I will definitely be emailing you all of that information, so you're aware that it's set up and ready to go, and you could pass that information along. If there's any wellness topics or promotions that you feel we should focus on, please don't hesitate to email me. I love ideas. I love interaction. So always open to that as well. And I just wanted to take a moment and talk about those wellness emails that I send you every month. Well, that are sent out every month. So I think we're right around 11 o'clock. So before Kelly hops into the appeals process, Jason, did you want to do the little mini break? Give everyone a little mental break from absorbing all information that they're being given?
Yeah, absolutely. I'm just going to share my screen once again. Bear with me. Here, so what I thought I would do today is not show this part, but our 5, 4, 3, 2, 1. So I know we talked a little bit about opportunities around emotional, mental health. It affects us all. We have a lot going on, whether it's at home or at the workplace, but throughout from today on, we really are going to start to bring to the forefront some opportunities around mental health and mental health resources. Maybe it is a quick tip, such as one that we call 5, 4, 3, 2, 1. It is a grounding technique. So this is something that I would encourage you to do throughout the day. This is our mental health break from our benefit training this morning. So think of it this way. So where you are sitting, if you have a chance, 5 things that you can see. So look around you, notice your environment, your surroundings. What do you see? Name 5 things. 4 things that you can feel, right? So maybe you have a mouse, maybe you have your keyboard, I'm sure your cell phone is right there. Those are, try to think of 4 things that you can feel. So understanding what's going on, what does your environment have in front of you? 3 things that you can hear, right? So I can hear myself talking, but maybe there's other noise in the background that might be distracting. If you can notice those things, you know that you are right there. That is your present tense. 2 things that you can smell. Maybe it's somebody cooking in your kitchen or in the workspace. Maybe there's a fresh cup of coffee that's by. So 2 things that you can smell, that you can pick up on. And then the last 2 here, right? So one good thing about yourself as you go out throughout the rest of your day. Think of it, right? So what is one good thing about yourself that you see within yourself right now? Take a deep breath to definitely end this exercise. So the 5, 4, 3, 2, 1. It's a great way to step away, to walk away if you have the chance to. It is a technique that we have. We have a variety of different tips and techniques, whether it's breathing, but this is a good one that potentially you should do every day and share with your colleagues.
Thank you, Jason.
Thank you.
And then we'll hop right into the appeals process flowcharts with Kelly. And keep in mind, if you need to take a break, because I know we've been sitting for a while, feel free to stand. You know, if you need to shut off video for a minute, totally understand, because it's a long training. So thank you.
Yeah, shake it up, guys. Like, we're at 11 o'clock. Everyone's very quiet. There's a lot of information, but there's a lot of great information. All this information is so helpful for you guys, as well as the subscribers that you serve. So, you know, take that 5 seconds, get up, stretch, because, you know, what more to talk about appeals and a grievance. It's a very exciting topic. So if you're standing, it makes it even more exciting. And moving around a little. So I'm standing and I'm moving around a little. So let's see if we can get through this a little bit before I kick it over to ProAct. So just wanted to quickly highlight and spend some time talking about appeals and grievance processes. And there's a couple of key pieces that I do want to point out. Keep in mind, it is very, the probability is pretty low that, you know, there is an extensive grievance and appeals process that takes place or goes through external appeals. A lot of this stuff does get handled internally through customer service and through the review process, but do want to highlight there is a vehicle for your members to take advantage of if they run into that situation. And I know on the slide, the content is probably pretty small, so I apologize for that, but I know Kylie did include this in the attachments in the email she sent the other day. But just a couple of pieces I do want to call out is there are 3 key pieces around the appeals and grievance process. One is around the internal appeals, and that's when benefits are deemed not medically necessary. The members do have the option to form to send in an appeal through the customer service representative, so they can call into customer service and talk through that process with them, or file something formally through the customer service department. That review is then given to our medical director, who will ask for supporting information of why potentially that was denied and what is the need for that. There are times where that decision is upheld or overturned. So there is a process in place for that. The other piece is around the grievance side of the house, and that's really when there's a contractual benefit denial. So something within the confines of the benefit plan, there is a denial, an outright denial for that. Members do have that same process to file a grievance. They can contact customer service either through the phone or through the mail for that. And again, that gets reviewed by the case manager internally to determine what happened in that situation. And again, there is the opportunity for that decision to be upheld or overturned based on that. If the member does not like the outcome of that decision, they do have the option to go through the external appeals process, as well as going back to the consortium for review of that. The consortium, as the ultimate say, whether, and they do have a committee for that reviews those, but it's likely that it would never get to that situation because all of this stuff is kind of done internally for that. So just know that there is a formal process in place for grievance and appeals. Members do have the option if they are getting a benefit denial, if they are getting additional notification that supporting documentation is needed, that there is a process for that. And this is the process that is outlined. When all else fails, members can contact customer service and ask questions, and you can certainly contact customer service or the consortium as well. Does anyone have any questions around grievance and appeals relative to the Excellus side? Okay, so I'll turn it over, I think, to Taylor and Morgan and the ProAct team to go through the prior authorization and process with them.
Thank you, Kelly. Hi, everyone. Good morning. My name is Morgan Randazzo. As Elin mentioned earlier, I am the new ProAct account manager for the consortium. Thank you so much for having us on today. In the interest of time, I'm just going to turn it over to Taylor Michelani. She's going to be going over the prior authorization and appeals process. And Taylor is the ProAct clinical pharmacist. So take it away, Taylor.
Thank you, Morgan. Can everybody hear me okay?
Yeah.
Okay. So thank you, Morgan. Thank you for everyone on the call for allowing ProAct to spend some time reviewing our prior authorization and appeals process. So this will be a very high level overview and just kind of the basics of the process. This one-page PDF is a great resource. Kylie, we can definitely share this out to the group if you haven't already done so. So just kind of a snapshot of the prior authorization process and what the requests are. So when a doctor submits for a prior authorization request, they are subject to validation against both member-specific prescription drug coverage and then clinical criteria guidelines, which that then looks at clinical effectiveness, medically necessary, alternative therapy costs, goes through a whole process of questions that we look to see answered to deem that medication to be approved. Approval and denials, as well as lack of information. So if the doctor's office doesn't get back to us with some information that we need to make the decision, there are notifications that are sent out by fax to the provider and mailed to the member to the appropriate parties, keeping the healthcare team and the patient informed of the PA outcome. If ProAct does not receive enough information to make the determination, we will reach out to the prescriber at least 2 times to attempt to obtain the additional info. And if that is not received from the prescriber, we will dismiss the request. We will dismiss the prior authorization and notify the member and the prescriber. So this PDF flowchart kind of just shows the process of the prior authorization. So at the beginning, a standard prior authorization, our prescriber can visit our ProAct's Prompt PA portal, which is a website. The website's listed there below, where they can answer clinical criteria questions that have been developed for that particular medication, attach clinical notes and any information they feel is pertinent to the decision of approving or denying the prior authorization. This is our preferred pathway of starting a prior authorization. There are providers out there. We see it, I think it's about 50-50 utilizing Prompt PA, while the other 50% still just faxes manually information into ProAct. So Prompt PA is definitely the preferred method, and it's definitely the most streamlined, the most efficient, and gets the information in front of our clinical team the quickest. So making sure that providers are comfortable with that website and logging into that is definitely something that we want to make sure we work on. There's 2 outcomes when it comes to a prior authorization. So request is either approved if the patient meets those clinical criteria guidelines and questions that are answered appropriately. Clinical notes are provided as we need them. Typically, we'll see clinical notes included for specialty medications and some of the higher cost medications. So they can be approved or denied. Denial, like I mentioned, if we haven't received all of the information we need, or if they don't meet the clinical criteria questions. So once it is denied, there is the opportunity for the provider to start an internal appeal process. Appeals must be made in writing and submitted along with a copy of the original denial letter. And then these appeals are reviewed by a licensed pharmacist that's within our clinical team. They need to be submitted within 180 days from the date of the original denial of the claim. And then requests for urgent appeals will be acted on within 1 business day of receiving. Requests for standard appeals will be acted on within 3 business days of receiving. So the difference between those is just if the provider deems it urgent or standard. So they can select that within the Prompt PA portal. So they can approach the appeal just as they would have from the beginning of the prior authorization process. So through the Prompt PA portal, attaching additional information, the letter of appeal, or medical necessity and answering any additional pertinent clinical criteria questions. From there, the same two outcomes can happen as I described before. So the request can be approved or it can be denied. If an internal appeal is denied, it then can shift into what we call an external appeal. So the provider will, again, visit our Prompt PA portal, attach a request for an external appeal, and answer any pertinent questions that maybe they were missing previously. And then we submit the request to an external review agency. This is a different set of pharmacists that would be then reviewing the appeal. However, initially, when we receive the external appeal, if we feel as though the information that was provided to us would result in an approval, we will move forward and just approve it on our own on the PROACT side. However, if the original appeal decision we still feel stands, we will then send it to that external review agency. Like I said before, the external review will be performed by a group not associated with PROACT or PROACT's internal review board. If the group decides to overturn PROACT's denial decision, PROACT will provide coverage for the medication. If requests for an external review must be submitted within 4 months after receiving the initial appeal. So 180 days for the internal appeal, 4 months for external. And the external review organization is something that is required under federal law to complete the review no later than 45 calendar days following the request being submitted. So those are a little bit longer turnaround times just because it's an external review agency that we're sending off to. Any additional or any questions, I guess, on this process? There's definitely a lot more that goes into it, but this was kind of a brief overview of what our prior authorization and what our clinical team does to, approve and or deny a prior authorization.
Taylor, one of the reasons, thank you for that presentation, for the group in general, one of the reasons we asked PROACT to cover this today, we usually find that there's no problem with PROACT adjudicating claims and having prescriptions filled at the retail pharmacy. What feedback we do receive is why are prior authorizations taking so long? So that's why we put it on the agenda so that PROACT could talk about the process that it goes through, but also to help your employees know that by suggesting to the provider that instead of faxing, they use the provider portal, and that an employee is aware of the appeal process if they feel something's not going well, but also to just encourage employees to pick up the phone and call PROACT. A lot of times when the employee calls PROACT themselves, instead of just constantly going into the pharmacy and saying, is my prior authorization approved? Is my prior authorization? PROACT can talk to the employee and find out additional information that can either go back to the doctor's office or advice can be given from PROACT directly to the doctor's office to help move things along. But PROACT has already put some things in place that we thank you for. When prior authorizations have reached their 1-year anniversary and need to be reapproved, letters are now going to the home. So employees are aware they need to get into their doctor, they need to get into that, get in for that approval. And also for some cancer patients and other patients, the approval will last for more than a year on a chronic condition. So there are some other gray areas outside this process, but we thought it was really valuable to have PROACT come today and talk about it so you can educate your employees and also to help them move this process along. So thanks, Taylor. Taylor usually doesn't join our team, so she sat in yesterday to find out we were an okay group today. So thanks for doing that. We appreciate it.
Yeah, a couple comments I just wanted to throw out there after you, the things that you spoke about, Elin. So our typical turnaround time is two and a half days, but that's when we have all of the information. So there are a lot of times where we are waiting for the doctor's office to get back to us on some missing information that didn't come through initially. And then again, I can't stress enough that prompt PA portal, when they leverage that, it just shoots the prior authorization right into our queue, right in front of our clinical team. If they're faxing it, it's going to go into a document queue and we have to work through that queue. So it's a little bit longer of a process. So the prompt PA portal is definitely the key to getting the prior authorizations through as quickly as possible. And then hopefully the doctor can communicate back if there's any missing information, because that's typically where a prior authorization will kind of get caught up in the process. So.
Thank you. And another thing I learned from Corey is, and part of this appeal process, there's another handout that we shared probably a month or two ago, I think, in our wellness program, is don't leave the pharmacy. If, if they're telling you you don't have coverage, don't leave the pharmacy, make a phone call to ProAct, verify your coverage. That it's much easier when you're standing in front of the pharmacist to get these things figured out. And which is another point, we talked about the ID cards, and in the past we've had 2 ID cards. So people show up with their Excelis card and they say you don't have any prescription drug coverage, you're going to have to pay the full cost. Next year, thanks to Excelis and ProAct working together, we are going to have one ID card and it will say ProAct on it, and it'll have the all the prescription fill information that this needs. So they will know the difference between Excelis and ProAct, and hopefully nobody will be standing in the pharmacy saying, my department told me I had coverage. What do you mean I don't have coverage? But really encourage your employees to try to resolve the issue while they're standing in the pharmacy, by calling ProAct, by asking the pharmacist to call ProAct. But in the future, they'll have just one card, which will also streamline things. Kylie,
Okay.
back to you.
Back to me, huh? I didn't have any questions. Taylor definitely spelled it out very simply. I've assisted a few members with this process, and really where it gets held up is the doctor's office submitting supporting documentation or updating a diagnosis code. So something important to remember, if they're saying, well, I go to the pharmacy and the auth isn't approved, it's not the pharmacy, it's talking to the doctor's office and making sure that they're doing the next steps. This flow chart is available on our website. We did email it out with the agenda as well. I've honestly found this a useful tool to even send to a doctor's office because it has the customer service number on it. It has the website. Last I knew, they don't even need an account for the authorization website. They can just go right to the, yeah, Taylor's agreeing. You can just go right to the website, plug in the information. They don't have to do this whole account creation, new password, all of that. So it's very easy for the doctor's office to use. Rather than faxing, like Taylor had said, it really delays the process. So thank you so much for presenting, Taylor. Really appreciate it.
You're very welcome. Thank you for having us.
And I think I'm going to throw it back at Elin now to chat about Cobra. But before she takes it over from me, I do have, I think this might be our last poll, I promise. And this is about Cobra coverage. So the question is Cobra coverage offered for 18 months or 36 months through the consortium? So I'll give you a couple minutes to respond. And we'll see where we land. All right, we're right around 70% participation. So 64% said it's 18 months coverage and 36% said it's 36 months coverage. So with that info, I will let Elin discuss our Cobra coverage.
Great. Thank you, Kylie. Thanks for doing that poll. So there's been a lot of confusion. So I just needed to check, make sure my mic was on. There's been a lot of confusion over Cobra and eligibility for Cobra, and how, as a small municipality being part of a big consortium, things are a little different. So there are some nuances that come with being part of an Article 47. For example, if you are a small organization and someone is on Medicare, Medicare usually becomes the primary payer. But when you become part of a larger organization like the consortium becomes the primary payer when you're on Medicare. So there are little things like that, but also being part of an Article 47 means we have to comply with some New York State mandates and New York State laws, which includes the addition of 18 months. They call it mini Cobra for some reason. And I believe it was championed back in 2009 and passed specifically for some of the New York state insured organizations. So we are bound by that mandate. And when your employees leave, they have the opportunity to pick up Cobra for 36 months. So we have a Cobra Toolkit that Kylie or myself can send to you. If you do have someone that's going out on Cobra and someone who is asking information about it, they will get a notice of termination from Excelis, which will offer opportunities on the New York marketplace and how to secure benefits on the open market. But they do have the opportunity to purchase Cobra. And that would be through you and pay for Cobra 100%. And Kylie and I can help walk you through eligibility for Cobra, the notices that are necessary for you to send with Cobra, and talk to you about how you go about billing for Cobra, which is something we're talking to Terry about too, to help it be as easy as possible for you, the organization. So just wanted to let you all know that we are covered for 36 months. It's the minimum amount. We, as members of the consortium, are liable to cover. Also let you know that 6-month free period during Cobra, when you could get your Cobra for free for 6 months, that is also over. And I know a lot of you, what you're thinking is, I don't have anybody on Cobra. Cobra is just way too expensive. And if people are leaving my employ and not picking up another employer, they can't afford Cobra anyway. There are great resources on the open market, the New York State marketplace, which was created out of the Affordable Care Act. Excelis has resources to help you negotiate that. You can go to the New York State marketplace that has a ton of information there, or you could always call Kylie and she'll point you in the right direction. But did want to know that these resources are available for your employees, and you should be offering, and you should be within a certain period of time after someone terminates employment, notifying them of the rights to pick up Cobra. So that was just a quick update on Cobra. Thanks, Kylie.
And we do have sample letters that you could format to your municipality. So don't think that you have to reinvent the wheel. If you want sample letters, we also have a FAQ on Cobra. And I do believe you can also charge an extra 2% on the premium for administrative fees. So there are some aspects to offering Cobra that if you need that information, just let me know and I can email you out that toolkit. So double checking on our agenda here. it looks like Terry is up next to go over some of our billing procedures.
Let me share my screen, maybe. Can you see my screen? Other than I have something here I don't want in the middle of it. So I'm just going to go over some tips, tricks, some examples of some of the invoicing nuances that I'm sure some of you have seen come from me at one point or another so far. So I want to just give some timing issues, or not issues, but some information on timing for billing. So enrollment changes that are entered by the municipality, or in most of our cases on this call, it'll be by Kylie. If they're entered by the 12th of the month and actually entered by Excelis, I'm going to pick them up when I run reports on the 14th. So I'm basing all the billing that I'm doing for you guys on a report I run out of Excelis on the 14th of the month. So that's kind of the cutoff we have to go by. So if something gets entered on the 13th, it may or may not make it, but I'm going to guess not, because I think there's some timing on the Excelis side to make it happen and get on the report that I run. So we're just going to use the 12th as the cutoff, and 99% of that should make it on the next month's billing. We do only invoice in full months. So if someone is terminated as of the 5th of the month and their insurance is through the 5th, you will be billed for that month. So I just want to put that out there. And the other thing is that I know I'm billing you guys so far in advance, and I know I get questions on why I'm billing so far in advance. This was set up long before I started, and it actually does make sense. If you have to process through an abstract, it gives you enough time to get it on the abstract and still get us paid by our due date. So I'm actually working on December bills right now because it's shortly after the 13th. So I will have them to you so that you can get them on November's abstract and due to me November 30th for December's insurance. So that was why you're seeing them so early. It does seem a little ridiculous at times that I'm billing for December and we're only in October. So I do understand. I just want to go through some examples of how the timing will work when we're talking about a mid-month reporting. So I have Tom Jones. He was hired February 1st. His enrollment form was entered prior to the 12th. So the reports that I run on the 14th will show Tom Jones on it. But because I'm billing 2 months in advance, there'll be a retroactive adjustment for 2 months. So there'll be February and March adjustments on the April invoice that I'm sending out. So this is where it gets confusing, and I understand there's still some months I look at things going, what? But I just want to put this out there. So there's a few different examples that I'm going to go through. If you have a question, feel free to reach out to me anytime if something doesn't look right. If you have a question on the actual entry of the form, you can ask me that too. I'm most likely going to defer to Kylie, but between the two of us, we can definitely help you out. So we have Anita Baker. She was hired on May 1st. The form wasn't entered until the middle of June. You probably didn't get it back from the employee for whatever reason, it didn't get entered. So when I run the May 14th report, she's not going to show on there. So there's going to be no adjustment for her, no anything. I don't even know she exists when I run the June billing. So when I run the June report, it's still not going to be on there because it wasn't done until after the 12th of June. Another month that I don't even know this person exists. So then when I run the report in July, we're going to actually have a 4-month retroactive adjustment for May, June, July, and August, all coming through at once. So you'll see things like that. So there might be, in this case, this was a new hire, but if it was a termination, you would see 4 months of credit coming through all at the same time. So this one, I know Kylie mentioned this, and Kylie, with her doing the actual entry, is more than likely going to ask this question when she's trying to enter these into Excelis for you guys. So Jack Black terminated on June 30th. So if the enrollment form is entered with 7/10, and that's the date it was entered or provided to Kylie, the term date was dated 7/1, I'm still going to charge you guys for July. So this is where I think Kylie and I are both trying to work with you guys and get this so that we can explain to you that you're going to get billed for that whole month if you put his term date as 7/1. So you actually want to put his bill date as his end date as June 30th. That's when he actually, it was his last day. His insurance will go through June 30th. So I just kind of go through, and you're more than welcome to read this, but basically what I'm saying is I'm going to bill you for July. So in this example, municipality would be paying for the full month of July by putting a term date of 7/1. Whether he's there or not, I'm going to bill you because I don't know any different. So if we use the correct term date, we're still going to do a retroactive adjustment for July and August by the time it actually comes through Excelis, but you aren't going to pay for July. I'm going to credit you back for July. So we should be okay. As long as we just have to watch the termination dates and make it actually their termination date. So like I said, if you have any questions about it, please feel free to reach out. If you get an invoice and something doesn't look right, let me know. I'm more than happy to work with you. And I would much rather, if you find an issue with an invoice, fix it before you guys pay it. And then I'll send you a corrected invoice. We've got plenty of time, month and a half before I have to have it in the financials. So I would rather fix it for you guys as we go through it than to have you come back to me 2 months later and try to fix something. So please reach out. But we are changing our invoicing starting with 2022. I think most everybody was probably copied when I sent out the new rates for 2022. It was in a different format. It's going to be very similar to how the invoices will be prepared starting in 2022. So the one I'm sending out this week will not be like this. This is just 2022's rates. This is very tiny, I realize, and I don't know that I can make it any bigger. Oh, I can, but this is the spreadsheet that I'm sending out now. That this has happened. This is probably maybe the 3rd or 4th month that this will be the backup provided. So I kind of wanted to give you guys a little insight to what some of the fields were that might help to verify information. So when you get over here to contract type, contract types, there's either a 1 or 2 through 5. So we only offer individual or family. So when I'm doing pricing, you either are a 1 and it's individual, or 2 through 5 I add together, and I'm going to charge you a family rate. Status, if you get over here farther, there's a subscriber status of active. So if it says active, that's current month charges. If it's blank, I actually cut and paste that down below in the file that I will send you. And those are all retroactive adjustments. So if it's a blank subscriber status, it is a retroactive adjustment. And then the only other, most of the small guys like you guys don't have many of the class IDs. And if you do, then this will mean something to you, and it'll be either A100, C100 would be your Cobras, R100 would be your retirees. But when you're looking at these subscriber effective dates and subscriber termination dates, these are the Excelis dates if the subscriber status is active. So this is the report I'm running in October is for November for Excelis. But if this subscriber status is blank, these 2 dates are true dates. So this will be where I'll see a person's termination date of 10/5, for example, and I'll know to bill for the month of October, but that's it. So these dates you'll see mostly are going to be the date the report is for. The only time that these dates really mean anything is when it's an actual retroactive adjustment. And then this will be the new format. and it's really, it looks the same in theory. So the big change is that we're going to just bill you at one individual monthly rate. So we're going to add medical and prescription rates together. It'll just be a flat amount. So platinum plan, you know, for individual, it's $728.93. That'll be the rate. I'll just change the number of policies, which would be your subscribers. Other than that, it looks pretty much the same. So I just have one request. I've tried to reach out to all that I have direct contacts with. We've changed our address for remittances. We are now using a PO box. I'm not located in the Tompkins County building. So by using the Court Street address, I don't think our invoices and our payments are always getting to me timely. So if everyone could make sure that our address is changed to PO Box 7, Ithaca 14851, I would very much appreciate it, and we can get your payments applied faster.
And that goes for anything that you have to, that you are sending us. Mostly it's just the checks that come through there. Portal is really for all employee benefit forms to use the portal. It's, you know, confidential HIPAA approved, as Kylie spoke about earlier. Faxing us, we're going to probably do away with our fax machine. Not that you can fax in checks, but just in general, please start using our PO box. We definitely do not get faxes timely, but the portal not only goes into our files, it goes into a general file. So we always have it on record that was sent. So please make note of that.
I think that's all I had. So if anyone has any questions, or like I said, feel free to reach out anytime you get a bill that you have a question on, or if you have a question on a new employee or a terminating employee, feel free to reach out to us. You know, Kylie and I, between the two of us, we will definitely be able to help you.
Thank you, Terry. And next up on our agenda is the beneficiary audit in 2022 that we're working on planning. Ellen's gonna discuss that aspect.
Yeah, very briefly, because Kylie is gonna take us home. In 2022, you can expect some information from us on doing an audit to make sure all your dependents are dependents. We did an audit several years ago, and we had over 200,000 in claims on a much smaller consortium for people who were no longer covered on the plan. So either you didn't drop them off, or their significant other didn't drop them off. Usually the case with dependents is a spouse or domestic partner who is no longer a spouse or a domestic partner. As you know, you should be getting notifications directly from Excelis right now when someone ages out. We were carrying people before who were post age 26, but now you do get a notification when someone turns age 26, and you should be giving that person a Cobra notice because they drop off at the end of the month once they age out. And but it's the other group that we don't know about. If someone has dropped a family member off, or a family member has picked up coverage on another plan and you don't want them to be a secondary on our plan. So we will do an audit, just so you're all aware, and make sure that all the people who are covered need to be covered. Kylie has been working on that member verification form. I know there was something in the chat room and said, do you have to fill it out for singles? And not really. We need this single information if we're going to figure out who the dependents are that are go with them. And we, the consortium, don't keep those forms. You do. So it's good practice for you to make sure you're going down through the checklist. The other thing that Kylie has done to streamline things and to make significant others real domestic partners and to confirm that they are living together, they're financially bound, and all the other things that come with a true domestic partnership, including dependent children. Kylie's reprocessed that form as well, which is on the internet, but also went out in the email regarding this meeting. So stay tuned, that's coming soon. And it's a great way to identify how to save money in premiums and how to keep our claim costs down by not having people on the plan that should no longer do that.
And Elin, if I could just add to your section, additionally, it's important that there are no ineligible members on the plan from a stop loss perspective. If we have a large claimant and that it does go above the deductible, we have a rather high deductible, and it is found that there's an ineligible member, the stop loss carrier might not pay that claim and the plan would be on the hook for the high claimant. So just that's another example as to why we should definitely verify and make sure that there's only eligible members taking part in the plan.
Thanks, Rob.
All right, so thank you, Elin. I'm going to jump right into the case studies presentation. I know we're all getting a little antsy and we're nearing the end of our time together. This part does have you kind of interacting with each other and chatting a little bit on the breakout rooms. So just a heads up that you may have to unmute and chat a little bit. You've been so quiet today. I'm hoping for a little bit more interaction towards the end here. But let me bring this up here real quick. All right, everyone can see that okay? All right, beautiful. So this presentation is case studies. So as I've worked through issues and problems that have come into the consortium, I've realized some common areas where I always get questions on. So I wanted to go over a few examples just to make sure that we're all on the same page and we all have the same information about options. So I have changed the names of the members as well as the municipalities. So I'm not, calling anyone out on the carpet for any issues that may have resulted. So if you see a municipality in here, it's probably the wrong one that's listed for that member in the example. I will also say too, that these case studies cover the whole consortium. So not all of the municipalities on the call today may offer a Medicare supplement plan. Not all of them may offer a PPO plan or a classic blue plan, but it's talking about the overall options that the consortium has available. If you were to add additional plans, that cutoff date was October 15th this year. So we're now moving into the open enrollment period where subscribers, if you have multiple plan options, could choose to change their plan. But to add additional plans in, that cutoff date was the 15th of October. So this first one we're going to do together, and probably the next one, I'm going to throw you into some breakout rooms so you guys can chat for a minute about options. So case number one, mixed age retirement. So John is retiring in January 2022, the month he turned 65. John plans to have original Medicare with a Medicare supplement plan through the consortium. John's married to Haley. Haley's covered under John's active employee coverage currently, which is the PPO, and will only be 62 at the time of John's retirement. Can John still join the Medicare supplement plan? And what insurance options does his spouse Haley have? So to answer that, yes, John can join the Medicare supplement plan. But then what happens to Haley's coverage if he joins the Medicare supplement plan and she's obviously not old enough, nor does have Medicare yet to qualify her? So option number one is she can stay on the retiree coverage and she can have the PPO plan until she ages into Medicare. and he would maintain the Medicare supplement plan. Not all municipalities choose to go this way because it is a little heavy on the administrative side, because you have to maintain both of those records. And then when she ages in, Excelis would notify you, and then you could bump her into the Medicare supplement plan. Not every municipality offers the Medicare supplement plan either. So some municipalities may opt to keep both on the PPO until both the subscriber and spouse are of age to go into the Medicare supplement plan. Or John could go to the Medicare supplement plan and Haley could drop off of his coverage and look for coverage through the health insurance options through New York State of Health. Keep in mind that once you leave the retiree option, you can't be added back in. So this is one scenario that I've worked with lately. So case study number 2. Kelly is a new hire. On her health insurance enrollment form, she marks she wants single coverage, but she also marked that she's married and cover under her spouse's insurance. Do we need to know about the spouse's insurance? So this one, I'm going to let you guys go into a little breakout room if I can get it to work here. 1 second. And see whether we need that information about the other insurance, or maybe we don't. So it's not going to let me do it if I'm sharing. So you should be seeing an option soon to join a breakout room. Feel free to hop on in there and discuss whether we need the insurance information for the new hire for her spouse's insurance. Welcome back, everybody. Hopefully I didn't lose anybody in the process. All right, does anyone want to unmute and tell me what you guys came up with?
Yeah, I was in group 2 and we all said yes. They have to have the information so that decide who's primary and who's secondary.
You've got it. Awesome. Yes. We would need to know the spouse's information so we can work with Excelis to set up a coordination of benefits. Coordination of benefits is important because we need to know who pays as primary, but then also to create less headache for the employee. There's nothing worse than getting that phone call and being told, I don't know who pays first, but no one's paying. because that coordination of benefits wasn't established where Excelis is aware that there's a secondary payer, or that the spouse's coverage that used to be primary is no longer primary and is becoming secondary. So it's important to be aware of that coverage. And when I fill out the information in the Excelis website, the insurance information that I need is the name of the insurance company, the address, the ID number, and preferably the phone number. Those are all aspects that I have to fill in, which may or may not be on the enrollment form, but it's important information to include for me to be able to process. If you don't send it, I'll always reach out to you and ask you questions to make sure I have everything I need. Okay, let's skip on down here. Now this one is a little bit more complicated because there's multiple answers. So a big question that we get asked, or I get asked a lot, is, do I need to pick up Medicare Part B? And it's not always yes or no. So one of the contingencies is, are you actively working or are you retired? So Kasha is actively working for the town of Senate, enrolled in the Consortium insurance, and is turning 65 on January 2022. She's receiving lots of advertisements in the mail stating she could face a penalty if she does not enroll in Medicare when she is first eligible. What does she have to do? All right, so I'm going to force you back into those breakout rooms and see what you come up with, and then we'll come back and meet again. All right, I'm bringing everybody back. So I popped.
Riley?
Yeah.
Before you give us the answer on this, there was a question in the chat room on the last question.
Okay.
Could you answer who chooses the which insurance is primary and secondary?
Sure. Yeah. So it depends on who the subscriber is. So for the new employee that you're hiring, they're the subscriber. So that would be their primary insurance. And then their spouse's insurance would be secondary. So it's not based on date of joining whatever plan it is. It's based on who the subscriber is. So I hope that makes a little bit more sense.
So your employer is usually always your primary, unless you're buying some secondary type of insurance. But if you're going on your employer's plan, you are his primary on that plan, and if your spouse is employed, their employer is usually primary. Therefore, second, anything not paid gets kicked over to your spouse's plan.
Yep. All right, so I heard some answers in group one. Diane had a great answer in that she mentioned that they could still get Part A if you're actively working and covered under large group health insurance, which the consortium is. Even if your municipality only has five members or 5 employees, you're part of the consortium that has umpteen members and is large group. So the consortium insurance would maintain as primary, Medicare would be secondary. So then they could opt for the Part A for free. It's typically free. It's based on your work history. You need to have enough work credits to get Part A for free, which is normally 40 credits, which equates to 10 years of full-time work. It could be you or your spouse that has those credits to pick up Part A for free. And then you could defer or postpone enrolling in Part B until you're ready to retire. So then the consortium insurance would be primary, Medicare would be secondary. If you did what Diane mentioned, which was only pick up Part A is just your hospital and hospice coverage through Medicare. So you really wouldn't be showing your Medicare card at a doctor's office or a pharmacy. You would continue to show your active employer coverage through the consortium. I did make a little note here that once you're ready to retire, you should apply 3 months prior to retirement for Part B. It's a multiple step application process where the employer would have to fill out a document to show that you've had large group health insurance coverage, and you submit that in with a start date to Social Security, not Medicare, but Social Security. That's who you would complete the application for. You can also set up phone or in-person appointments with Social Security who can help you through that process as well. And when I say you, I mean mentioning that to your employee to do. So we talked about Medicare Part A and the credits that you would need. There's no late enrollment penalty for picking up Part A. So technically you don't have to pick up Part A in this circumstance. You could just opt to do neither part of Medicare and pick it all up at once. It's entirely up to the employee and what they feel comfortable doing. So what would we advise them to do? You can talk those options through with them about Part A and B, but really what I would encourage you to tell your employees is to contact their local Social Security office. There are federal protections in place that if an employee is advised incorrectly by Social Security, they can always go back and be enrolled with no late enrollment penalties into Part B. Medicare is the insurance enrollment in Part A and B, but they're going to be dealing with the Social Security Administration for any of the enrollment process. And since we're cutting it close on time, I won't force you back into any breakout rooms, I promise. So I do have a few more here, not very many slides left. So here's our next case example. Jim retired from Tompkins County at the age of 63. He's now becoming Medicare eligible January 2022 and wants to know if he needs Part A and B. He has maintained coverage under the Consortium Classic Blue plan while he was working, and since he has retired. Classic Blue has always paid his primary and Jim has no issues with coverage. Jim has not started receiving Social Security retirement benefits. So where does he begin, or does he even need Medicare? The answer is because he's not actively working and he's retired, he for sure needs to sign up for Medicare. The other tricky part is because he's not collecting Social Security benefits, Social Security doesn't know to automatically enroll him in Medicare. So he has to apply for Medicare. I encourage people to apply 3 months prior to turning 65 to give them time to process the application, send them the card. So everything's good to go the month you turn 65. Once Jim becomes Medicare eligible, the classic blue coverage becomes secondary to Medicare. He must enroll in A and B to maximize his coverage. Classic blue will not pick up his primary if he does not enroll in Medicare. And then this talks about the Medicare initial enrollment period, which is 3 months prior to turning 65, the month you are 65, and 3 months after. Once he misses that window, there's few opportunities to pick up Part A and B to not have any issues with coverage. So this is actually a case that I came across. I honestly can't remember what municipality it was with, but if Jim decided to not pick up Part B in January 2022, what's going to happen? The first time that Jim has a doctor's office appointment or emergency room, or even a preventative service like a colonoscopy done, he'll find a bulk of the bill is his responsibility. Classic blue will only pay 20% of an office visit after Medicare once they've aged in at 65. Even if the member chooses not to pick up Part B, Classic Blue is not going to replace that. So in Jim's case, he has till the end of April 2022 to enroll in Part B. If he waits till the very end of his initial enrollment period, then his Part B won't start until June 2022. So he's going to go half the year without primary medical coverage. But he would still not face a late enrollment penalty for joining that late. Once he misses the initial enrollment period, you then have to wait for either a special enrollment period or general enrollment, which would only begin the following January. So here's a few little tidbits I just wanted to throw in here because they're commonly asked questions. We have been seeing, newborn dependents being added to coverage. It is a faster processing if an enrollment form is submitted within 31 days of the birth. And I know people are out on maternity leave and such, so the hope would be that someone could drop off the form or email the form back to you as the benefit clerk, and then you would submit that through our website portal. But then we could activate the coverage sooner for the newborn. Coverage for a newborn would start the date of birth. That's just always been the rule. But if there's a delay in sending us anything past 31 days, I can't directly submit into the website. I have to put a request into Excelis, which can take an extra few days to be processed. So the sooner they can give you the information, the better. I've also seen it where with newborns, they say, oh, well, we had to wait for the Social Security card to come in. Newborns are the exception to the rule. We do not need a Social Security number to enter them in as long as it's within, I believe, 6 months from the date of birth. So don't let that hold up the application process.
I don't know if Rob's gonna pipe in here, but this is the same thing as previous when we talked about a dependent not being covered. If you don't add your newborn, and then 3 months later there are complications, and they have not been enrolled prior to those claims coming on, they're not covered. We can't add them to the plan and have it be retroactive. Our stop loss carrier would not allow that to happen. So it's really important that that information gets in there, because if there are any claims prior to adding, otherwise the individual has to wait to open enrollment. So they have to wait to add their dependent at a later date. And we want to make sure that's not the case.
The other question I get asked a lot is who can be on the insurance with the subscriber. So it can be spouse or domestic partner, child, natural, adopted, or stepchild. Anything beyond that family unit, it would have to be meeting the qualifications that are part of the requirements that were emailed out with this invite to the meeting. With the member verification form, it breaks down what dependents qualify, spouse, domestic partner, etc. So feel free to review those forms. If you have any questions, you're more than welcome to ask or email me later if that works better for you. So that is the end of the case study presentation. And I believe all that's left to cover is kind of to see if you had any questions about anything that's been discussed today, and kind of closing out our training for today.
All right, this has been a quiet crowd all day. Yes, yesterday we couldn't get through the agenda because we couldn't keep them quiet. All right, we do have a thank you hearing. We really want your feedback. We got great feedback from yesterday from some of the benefit clerks that attended that will only help us improve. So we don't want to always just hear what we did well. We want to hear what we can do better. So please, please, if you think of anything we did well, or more importantly, what we can do better, we'd love to hear from you. Shoot an email to Kay Rodriguez at Consortium now at tompkinsco.org. We welcome that feedback. I'd also like to thank all of our partners from Losi and Cahill and Excelis and Proact who have been on this journey with us, helping us put the agenda together and then helping us present the information. I hope you feel confident in the team like I do, especially with the consortium team as it grows. Terry and Kylie are great colleagues, and I feel very confident that we're building a much stronger consortium to serve you better going forward and to keep our rates stabilized and be able to offer the quality care that you want your employees to receive. So with that said, I'd like to thank Kylie for putting this all together for us today. Send us your suggestions for future agenda items. And I'll turn it back to Kylie in case I see she's put her email in the chat box. So if you don't have it, please pick that up. And Kylie, I'll turn it back to you.
The only addition I would make is just keep in mind, if you think of any employees in your municipality that might be interested in becoming wellness champions, feel free to throw me an email or a phone call. I'm more than willing to talk to them about that process. I promise it's not very labor intensive, but it may be a way to relieve some of the extra work that our lovely benefit clerks do for us every day. So just looking to try to make things easier. Always open to suggestions or information or questions. So thank you so much for joining us today. Have a great day, everybody.
Thank you.